Okay, so we're gonna go over flossing with a permanent retainer using Super Floss. It's a pretty simple technique. It's very similar to the technique that you used when you were flossing in between your teeth with braces. Because the wire is fixed on the back of the lower front 6 teeth, you'll need to floss around that wire. You'll need to continue to floss around that wire.
Okay.
So I'm going to show you the technique. All right, so the floss has 3 parts. This is kind of the needle and thread part. It's kind of stiff. This allows you to guide the floss. This is the super floss portion, and it's a little bit thicker, kind of like yarn, and it's really good because it picks up lots of plaque and food debris. And then you've got a longer section that's just like normal floss. Okay, so you're always going to start with the needle and thread portion, and what you're going to do is you're going to pass it right in between the teeth, pretty close to the gum line. Okay, you just had your braces removed, so the gum tissue is usually a little puffy there. So you have to kind of navigate the floss around the gum tissue and in between the teeth. And once you've pushed the needle part of the floss in between the teeth enough that you can grab it, then you can pull it from the opposite side until you get to the super floss section. And you're going to wrap it around your fingers 1 or 2 times, and you're going to push down into the gum tissue, wrapping the floss in a C shape around each tooth. So when you go in between 2 teeth, you have to floss both teeth, not just one. So you're going to make 2 C's, a C to the left and a C to the right. Now I want you to notice how the gum tissue is down below the gum line, okay? That's what you've got to do. That's where the plaque is hanging out, and that's what the floss is there to clean. So don't just floss on top of the gums. Make sure you go down below the gum line.
Okay.
Right now you'll see there's a little bit of blood, okay? Don't be scared if you see the blood. That's just the bleeding that you see is because the tissue is inflamed. So that's your body's way of telling you that you need to floss that area a little bit more, okay? You don't want to floss like a saw. You don't want to saw the gum tissue away. You want to make sure you floss down around the tooth. I'll show you again. So we're going to go to the next set of teeth. You're going to pass the floss in between the teeth, along the gum line, and below that wire on the back. Then you're going to pull the floss out until you get to the super floss section. Wind it around your fingers. Pull to the left so you wrap a C around one tooth. Then pull to the right so you wrap a C around the other tooth. And then you're going to pull the floss back out. Okay, so you're just going to make sure you do that in between all of the teeth that are included in the permanent retainer. As you continue to do this, the gum tissue is going to get more healthy, and it'll be even easier for you to get the floss in between the teeth below the wire. For the first week or 2, it'll be a little tougher for you because the gum tissue is a little puffy. For the most part, it's been pretty easy for me to get the floss in between the teeth, so I don't think you'll have a hard time doing this, and I'll let you practice before you leave. All right, the gum tissue is a little more puffy in this area, so it's a little harder to get the floss in position. You gotta make sure you go right along the gum line, and it may be hard to see in the video, but I can see the floss trying to come through on the opposite side. It's pushing the gum tissue by the tongue side of the teeth there, and the gums are a little puffy, so the gums are being resistant. Sometimes you just kind of have to keep giving a little bit of pressure to get it to go through, and that'll be a little uncomfortable in the beginning. Like like I said, because the gum tissue is a little swollen still. But once the gum tissue gets a little more healthy, it'll be really easy for you to get that floss there. Okay?